Should you ice your ankle after an ankle sprain? We used to refer to an acronym called RICE. It stands for rest, ice, compress, and elevate. We still stick to the compress and elevate part, but the rest and ice part, not so much anymore. It's become more common practice to avoid icing after an ankle sprain as it may lead to impaired tissue repair. The theory is that ice disrupts the natural inflammatory response, delaying the response from cells that help repair damaged tissue. This may result in a delay of blood vessel formation. As a result, we can't achieve proper revascularization of the area. The inability to get proper blood flow to the area makes it more difficult for the swelling in the ankle to decrease. With that said, experts aren't all in agreement about this just yet. And we think ice may have the ability to facilitate muscle contraction in patients having a difficult time contracting their quads after knee surgery. So when it comes to ice, I tell patients to use it for the first 48 to